Hi, everyone. Thanks for joining us for our webinar. I'm Dr. James Adams, and with me is Dr. Christina Flynn. She is my former PhD student who's now graduated, and she developed the MDM test for her PhD thesis. And she now works at Autism Diagnostics Lab and Gut Brain Axis Therapeutics with me. We're both proud parents of children with autism, and we're glad to have you here and excited to share with you the latest results of our published paper and an update on information on both the test is available and also on additional information on treatment, what to do with test results after you have them. And so I hope this information is very helpful to you. We'll have plenty of time at the end for questions. Feel free to type your questions into Q&A and we'll cover them at the end. So what we're going to focus on today is our diagnostic screening test for autism and gut-brain health. And we're focused on our new model, the microbial-derived metabolite system, which is our diagnostic tool for assessing gut and brain health. So just to give you a little bit of background, we do have a few disclosures to make. Both Christine and I have pending and approved patents related to biomarkers for autism. I'm also a part owner of Autism Diagnostics and the Autism Diagnostics Lab, which is developing the metabolomics testing for diagnosing and treating autism. I have pending and approved patents for the use of microbiota transplant and/or probiotics, and I'll talk about that, both for autism and related conditions. I will point out that MTT is an investigational treatment. We're currently in phase 2 clinical trials. It's not yet approved by the FDA. And we work closely with our partner, Analutos testing lab, which I'll tell you more about. So just a little bit of background first on gut issues and autism. We know for roughly 40% of children and adults with autism have obvious chronic gut problems, constipation, diarrhea, bloating, and pain. When we do medical histories, we find these almost always have begun in infancy in the first few years of life, the same time when autism symptoms begin. And we also see that children with worse autism symptoms generally have children with worse gut symptoms generally also have worse autism symptoms. But rather than focusing on the symptoms, we want to focus on what appears to be the root cause, which is bad gut bacteria and yeast. I published a paper 16 years ago showing there's a very high correlation of gut problems with autism severity. This chart shows that, for example, for speech, the children in blue are the children with autism who don't have gut problems. Those who do have gut problems in red had worse speech problems, worse social problems, worse sensory and cognitive problems, and worse physical and behavioral problems. So our hope is if we can treat those gut issues, we can greatly reduce those symptoms. This is a very powerful paper. It's now been cited by over 1,000 other research studies. So first of all, to give you a little bit of background on the human gut microbiome, your healthy gut microbiome is important. It helps you digest food. It helps produce certain key vitamins like vitamin K and biotin and folate. Also, it helps produce butyrate from fiber. Most people are not consuming enough fiber, and hence they're not getting enough butyrate, which is the primary food for the cells that line the gut. So it's a big problem for about a third or more of the US population. Also, our gut microbiome helps with water balance. It helps with regulating our immune system. It helps with competing against pathogens. Unfortunately, there are a lot of pathogens, especially in children with autism, that can damage the intestine. They can cause GI symptoms, constipation, or diarrhea. They produce toxins that can affect the brain. They can disrupt the immune system, and they can compete against the beneficial bacteria. So just a little bit of comedy here, again, giving you a sense that you have a huge number of bacteria in your gut. You have about as many cells of bacteria as you have cells in your entire body. So there's a lot of little bacteria living in our gut and growing every day there. The gut microbiome affects our health in many ways by producing beneficial metabolites, which I mentioned, bile acids, butyrate, key vitamins. But our unhealthy gut bacteria can produce some very harmful metabolites that can both damage the gut and also leak out of the gut and reach the brain and affect cognition and memory and general autism symptoms. There was a powerful study done 25 years ago showing that if you give a special antibiotic called vancomycin for 8 weeks, it greatly reduced gut symptoms, greatly improved autism symptoms. But unfortunately, the gains were lost within a few weeks when the treatment was stopped. But this study suggested that harmful bacteria are causing those gut problems and some autism symptoms, but that just getting rid of them isn't enough. It's like having a garden filled with weeds. If you pluck out all the weeds, those weeds are just going to regrow. So it suggests we need to reseed the gut with beneficial bacteria, and that's what we do in our microbiota transplant studies now. So now I'm going to turn it over to Christina Flynn to let you know about her research and that we've done. Christina, take it away.
Sure. So I started my career with Dr. Adams by studying a compound called p-creosyl sulfate. I found that it was elevated in 17 of 17 studies, although that only includes urinary studies. If you include other bio fluids, it tends to get a little bit higher. 3 studies were able to make a correlation with severity of autism symptoms with p-creosyl sulfate levels. And this is especially important because we know that p-creosyl sulfate is a toxin. It's a uremic toxin. It's a kidney toxin. It's a brain toxin, and it's a gut toxin. It can also impair immune functioning. So while we were looking at that, we discovered that there were many other metabolites that can be toxic in high quantities, especially during the developmental phase, that we were reporting that the data came in that were significantly elevated in autism. And almost every child with autism had at least one or more of these extremely elevated microbial metabolites. So here's our paper that we wrote about it. And since this one has come out, there have been about 6 studies also finding the same thing, where p-creosyl is almost exclusively higher in autistic children than in any typically developing children. Okay, so here is a rundown of just one of the examples of the microbial metabolites that are elevated in autism and their health effects per on each organ or organ system. So the gut, the brain, the mitochondria, the liver, the kidneys, the immune system, and then just overall ASD functions. So we know that it's toxic. We know that it can, in high concentrations, lead to many impairments to the gut, to the brain, especially during development, mitochondrial functioning, which is a very important concept in autism, biostatistics. The liver, it can put an additional burden on liver because p-creosyl, the compound itself, is what comes out of the microbiome that the human body goes ahead and converts it to p-creosyl sulfate, which ironically happens to also be a toxin. Same with kidneys. Kidneys are affected because a lot of p-creosyl creates a lot of high stress, oxidative stress. And this leads to kind of the common 3 underpinnings of what we are confident make up ASD, which is oxidative stress, immune dysregulation, and mitochondrial dysfunction. So the ASD specific category, that one is really interesting to me because it has to do with mouse studies and other rodent studies. Because ASD behaviors can be induced by providing p-creosyl, either injecting it into them or even just feeding it to them for a short, brief time. So an experiment, Bermudez 2021, went ahead and took 2 groups of mice. They gave oral p-creosyl to one and they gave saline to the other. And they observed that the mice who received oral p-creosyl developed ASD-like behaviors, whereas the saline ones were kept as controls and typically developed. But when you took a FMT, a fecal microbial transplant, from the ASD people, and gave it to the healthy mice, they developed autistic behaviors, and the reverse was true. So if you gave a FMT from a healthy, typically developing mouse to one that had developed these ASD behaviors, it rescued socialization. So we went out and we did a literature search. We found 49 different studies, and this is in urine alone, of 11 different microbially derived metabolites that were found to be higher in ASD versus TD urine. So that's pretty specific. It's not just the particular metabolites, it's also where they come from, as well as what bodily fluid it's been found to have altered concentrations in between autism and controls. We just published a paper in Nature's Molecular Psychiatry called Elevated Microbially Derived Metabolites in Autism, a Possible Diagnostic Screening Test for an ASD Phenotype. So what we found is that 90% of children had at least one or more elevated MDMs, and 0 of the typically developing children did not. Of the children that did have autism, 64% had a tryptophan-derived microbially derived metabolite. 60% had one that was related to tyrosine and dopamine, and 17% had elevated yeast metabolites in their urine. So serotonin and melatonin, which come from tryptophan, are related to sleep, cognition, mood, and just general other important things in the brain, whereas the dopamine from tyrosine is especially important in attention. Yeast metabolites, there are the ones that we discovered that had high levels of yeast metabolites. While they don't have a directly known problem, arabinitol, citramalic acid, tartaric acid, etc., they don't have a direct impact on human health. However, we believe that because they are a sign of an overgrowth of yeast, the other toxins that are produced by the yeast may be causing issues. So this is from our, like I said, recently published study in Nature's Molecular Psychiatry. And this shows the differences for each metabolite, the average difference between ASD and controls, raw p-values, corrected p-values, individual aurochs, which for those of you who don't do a lot of statistics, an auroch is basically an indication of how well that one metabolite individually is able to separate the groups into two different accurately. And so we also went ahead and calculated what percentage of the ASD population were above the maximum typically developing value that we found. And so these are the results. This was initially done on a untargeted metabolomics data set, meaning that they were unable to confirm the identity just due to the limitations of the technology. So we went ahead and reported these as we found them. Next. So when we went to go ahead and see how the MDM system was going to hold up and work, not just on cohort 1, that was the training set, if you will. That was where we came up with our list of metabolites. So on the y-axis of each graph, you can see just how many metabolites are elevated for each person. So the red triangles represent the ASD population, and the blue squares represent the TD population. So we found in cohort 1 that 90% of the children with autism in the study had one or more microbially derived metabolites. to double check our conclusions, we went ahead and assembled a second cohort. And what we found was strikingly similar, because 90% sensitive and 100% specific in identifying those with ASD, which is exactly the same result that we found in cohort 2. 90% sensitivity, 100% specificity. And these are from 2 distinct groups with no overlapping participants. And you may notice that the age range, they're different between graphs. And that's just because the data available to us happen to come in like that. But the consistent findings and the independent reproduction of results look promising. So we used 50 children with autism and 47 controls in the first initial study. So that meant that 90% sensitivity translated to 5 individuals that did not score positive on the MDM test. So being really curious, and as a student, I wanted to go figure out why. And for 4 out of the 5 cases, we found some really, really, really interesting metabolite profiles that correspond to known inborn errors of metabolism that, depending on what state you live in, might not be tested for at birth. So we found that one person had argininosuccinate lyase deficiency. 2 siblings had something that appeared to be propionic acidemia, could also be methylmalonic acidemia, but the presentations are very close. And then we found that another one had glutaric aciduria type 2. So we propose a new phenotype, the ASD-MDM, which means ASD population that has microbially derived metabolites. The definition is where you have unusually high levels of any of the microbially derived metabolites that have been listed a few slides ago, that are all derived from aromatic amino acids. And the aromatic amino acids are tryptophan, phenylalanine, and tyrosine. Each of the children in both studies had 3, on average, elevated MDMs per person. Some likely affect neurological symptoms. Some affect both gut and brain symptoms, like p-creosol and p-creosol sulfate. There was a high variability in which metabolites are elevated in each person, and it represents approximately 90% of the non-syndromic cases of autism, meaning that anyone who had a previous diagnosis of Fragile X or Rett syndrome are excluded from the study. We retrospectively went back and realized that the phase 1 study that was conducted at Arizona State University on MTT greatly reduced p-creosol sulfate down 90%, which was back to normal levels. So in conclusion, 40% of children with autism have gut problems, but it appears that many more have hidden gut problems. Yeast doesn't necessarily, like yeast metabolites won't necessarily affect the digestive tract, but they can affect overall autism symptoms. We are aware that some microbially derived metabolites cause autistic symptoms in mice and correlate with symptoms in humans. The new test, it appears to keep holding at 90% accuracy in differentiating between ASD and TD individuals. In layman's terms, some of these metabolites can be overwhelmingly toxic. So we like to say that, as a good analogy, is that children with ASD are drunk on microbially derived metabolites. We call your attention to ethanol. It's a yeast-derived substance that when you drink it, especially at higher concentrations, it impairs thinking, speech, coordination, a lot of the symptoms that we also see in autism. So precreosol sulfate is 80 times more toxic than alcohol. So imagine if a child's body is basically being inundated with all of these microbially derived metabolites that are toxic and are flowing through their system all the time from early infancy, or I should say early life. It's going to affect a lot of different parts of their experience and growing up in the world. But the good news is that there are things that we can do about it. So microbial transplant therapy, for example, we know from our studies that it can reduce levels of precreosol sulfate back down to normal. MTT will likely also decrease many of the other harmful microbially derived metabolites and hopefully increase levels of beneficial metabolites back to normal levels.
All right, thank you very much, Christina. So now I'm going to go ahead and just say a little bit more about the two commercial tests that are available now, and also about what to do with those test results, how to go ahead and begin treating these problems. So how do we test for these hidden gut problems in autism? And so testing for these gut infections in autism is complex because we can't easily see inside the gut. There are thousands of possible bacteria and yeast in the gut. Many of them are beneficial, but some are harmful, and even small amounts of those can be very serious. It can be unclear which species or strains are producing a toxic metabolite. For example, for precresol, there are over 50 bacteria that can be producing it. Any one of them can be making it. So we feel that the best approach is to test for the metabolites in urine, because that means that the MDMs have left the gut and are able to reach the brain and ultimately be excreted in the urine. So that's a good way to test for them. So we formed a company, Autism Diagnostics, which I lead. ASU rated as the top spin-off company in the year we formed it. And we've been collaborating now with Analutos for 3 years to commercialize the test. And also now our new test from Autism Diagnostics Lab is also now available along with the test from Analutos. So excuse me, the test is a very simple urine test, easy to collect, freeze, and ship. Families can order the test themselves in most cases. You don't have to have a physician order it. The test includes measuring both the number of toxic yeast metabolites, arabinitol, tartaric acid, and citramalic acid. Also, it tests for a number of bacterial metabolites, some of which are dopamine related, like precresol sulfate, and some of which are serotonin and melatonin related, like indoxyl sulfate. So this will let you know, the test will let you know, do you have a yeast infection? Do you have a bacterial infection? What type of bacterial infection it might be, and how severe that infection is. And also test for the key amino acids that are the precursors to serotonin and dopamine. And then Analutos has a special bonus. They also test for gluten and casein peptides, which come from gluten and milk products. So in terms of interpreting the test, we found that it's roughly 89% accurate in the commercial version in distinguishing children from autism from typically developing children. Nearly 80% of children with autism test positive versus no typically developing children, because we set the cutoff very high. The test determines if a yeast or bacterial infection is present, and that's very important for guiding treatment. How severe is that infection? And we want to use different types of treatments for yeast versus bacterial infections. And then also for gluten and casein, we saw one case where someone was on a low gluten and low casein diet, but they hadn't eliminated it. They still had problems. And when they then went and fully went on a much stricter regimen, then they really saw clinical improvements. So advantages of this test is that we use state-of-the-art equipment, brand new LCMSs. We have excellent pediatric reference range, which is very important for typically developing children, and we're now adding reference ranges for adults as well from our studies. Our test, unlike many tests for autism on the market, is backed by a research study published in the top journal, Molecular Psychiatry, and there are over 50 studies that support the general finding of increased microbial metabolites in people with autism. You'll get results back quickly in 2 to 3 weeks. So great equipment, great reference ranges and staff. And again, we're all very dedicated to improve the lives of children and adults with autism. That's why I formed the lab. So how to order the test? We have two options. Analutos developed the test first in the UK. They can receive samples from anyone in the world. Patients or their physicians can order the test. There's both the combined gut health test, which measures the metabolites that we mentioned. That includes free shipping to the UK. They have a special deal with FedEx, so almost any place in the world that FedEx goes, they can receive samples from. And then their combined test with the autism screener also lets you know if you have unusually high levels of these microbial metabolites associated with autism. The prices are in British pounds, but I've also added the approximate US price as well. And then in the US, we formed Autism Diagnostics Lab, which 44 states allow patients to order directly from the lab. But in 4 states, California, Connecticut, New Jersey, and Rhode Island, the states require that a physician order the test for you. If you don't have a physician available, we can in some cases help with that. The test is not yet available in New York or Washington because they have special extra requirements just to make it much harder for tests to get approved there. But our test is CLIA approved, which means that you can request insurance coverage or reimbursement. Doesn't mean that you'll receive it, but you can try, and we'd be very pleased to try. My goal is to help make this test as free or nearly free as possible for autism families. So we really want to help you as much as we can to receive reimbursement for insurance coverage. That may take some time and some iterations, but we're very dedicated to try to do that for you. We have both the MDM gut-brain health test, very similar to the Analutos test, and then we have an MDM plus test that includes 8 other metabolites that look at measures of oxidative stress, needs for vitamin B6, and several other interesting measures. After you order the test online, and the kit will arrive. It's very easy to collect and just collect the urine sample. We have a special preservative to preserve it, and then just ship it back. So now let's talk about what to do if you have those test results. And so it helps to first understand where these problems come from. Why is it that roughly 90% of children with autism have these extremely elevated levels of metabolites from gut bacteria and yeast? So these gut infections can in many cases be due to excessive antibiotics, especially during the first few years of life, or from a C-section when the mother's taking antibiotics. They can be due to herbicides or pesticides in the food or in the home. Also can just be the infant received poor initial gut bacteria to start with. Also, if you're on a low fiber diet, most Americans are eating only half or less of the recommended amount of fiber, which you need from your vegetables, your fruit, your beans, your whole grains. Also, if you have just a limited variety of foods, if you just have a small variety of foods, you have a smaller variety of gut bacteria, and that's a problem for many people with autism. And then also 3 major studies have shown some children with autism have reduced digestive enzymes, especially for lactase, the sugar in milk, but also for digesting other simple sugars and starches. So that's also a problem. But this combination of issues means that they contribute to an increased risk of these harmful gut microbes developing in the gut, and they then leak out of the gut and can affect the body and brain. They can interfere with dopamine and serotonin and melatonin, and hence have a big effect on your cognition, your attention, your mood, and your sleep regulation. So what are the standard treatments for these gut problems, and what are additional treatments? The standard treatments are, first of all, just improving the gut, improving the diet, making sure you're eating a healthy diet of whole fruits, whole vegetables, beans and legumes, sufficient protein, not excessive sugars and junk foods. Some people need digestive enzymes, especially lactose if you're milk intolerant. Um, Fiber supplements can help. Again, we think the best fiber is from your fruits, vegetables, and beans, but adding limited amounts of fiber supplements can help. But we prefer a variety of fiber supplements rather than just one type. Probiotics can be helpful in principle, but in practice, most probiotics are the ones that grow in air, in milk, and hence are very different from the bacteria that grow in your gut. Roughly 90% of the bacteria in your gut are anaerobic, and so the ones that are the probiotics represent only a very small amount of the ones that are there. But if you're going to take a probiotic, we recommend a broad spectrum probiotic, especially ones that include bifidobacteria, because that seems to be some of the most consistently low bacteria. Laxatives are important to keep, if necessary, to limit constipation. If you think about how long a bottle of wine ferments, the longer it ferments, the more alcohol is produced. The longer that stool stays in the gut, the more fermentation is going to occur, and the more toxins will leak out. So we really want to limit um, uh, the length, the duration of time between bowel movements. We really want to have children having a bowel movement at least once a day, if not once for each meal, to get rid of that waste from them. Enemas, if absolutely necessary, is a temporary solution. Suppositories, again, if absolutely necessary. Antidiarrheals, again, only if absolutely necessary. Antacids in some cases. But we found that with microbiota transplant, when we treat the underlying constipation, that reflux almost always disappears. And then exercise, very often underrated, but if you take the extreme example of someone who's hospitalized and lying in bed for a week, they'll become constipated. So you need exercise to keep good motility in your bowels. But altogether, these standard treatments generally are only limited and provide temporary benefit. They're not addressing the root cause, which is the bacterial or yeast infection. So how can we get rid of that? So we developed a vitamin mineral supplement, which we sell through our nonprofit. I don't receive any revenues from them, but we've done many studies and shows been found to reduce GI symptoms by about 30% just by providing important nutrition for the whole body, including for the gut. We published a paper a year ago with Julie Matthews on a dozen different specialized diets, and different diets can be helpful for different individuals. And so that's a whole nother talk. But again, your diet affects very much what is going on with your bacteria, and you can shift the relative amount of bacteria within a day or two by changing your diet. It may not necessarily be enough to really change or eliminate an infection, but it can certainly reduce the severity of an infection. Customized probiotics, we did a study with Florey, again, trying to use advanced evaluations of all the bacteria present in a person, and then trying to choose customized probiotics for those person. But again, the limitation is that standard probiotics represent only 10% or so of the bacteria in their gut, and they generally don't engraft. They generally, when you stop taking them, they'll leave your body in a week or two. Antifungals, however, are very important. We'll talk a fair bit about those, and also about two commensal or beneficial yeast, S. boulardii and S. cerevisiae. And then also we'll talk very briefly about microbiota transplant therapy. We have a whole separate presentation on that. So just to give you a little bit more background on yeast, which we know the most about how to treat, this is a chart from a paper we published a year ago. The chart on the left shows the distribution of yeast in kids with autism. If we focus on the orange part, the left is the typically developing kids, and about half of the gut bacteria is Saccharomyces cerevisiae, commonly known as baker's yeast. It's present not just in bread, but also in beer and wine. And so it turns out that children with autism have much less of that beneficial yeast. So their level in orange is much lower. Instead, if you see that right above that big orange, the pale blue, and that pale blue is the very harmful yeast, Candida albicans. That's the most common harmful yeast present in children with autism, present in much higher proportions and in typically developing children. There are several other types of harmful yeast as well, but Candida albicans is the most common one. We found in this study that children who had more of the beneficial yeast, more of the Saccharomyces cerevisiae, they had lower autism severity. So you can buy the Saccharomyces cerevisiae supplement on Amazon or where many other places. And I think that's, although we haven't been formal studies of it, I think it makes very good sense to consider that. Humans have been consuming this in beer and wine and breads for thousands of years. To give you a little bit of formal research on antifungal treatments, there isn't much. This was one study by Bill Shaw, director of Great Plains Lab, which is now Mosaic, 25 years ago. He showed that using nystatin, which is a very common antifungal medication, he treated 23 children for a month, and they had partial reduction of the yeast metabolites, of order of 50% reduction. So most of the children needed more treatment, so we treated them for another 60 days, and that led to additional reduction of those yeast metabolites and some modest decrease in autism severity. Then there was a study by the Autism Research Institute. They surveyed 23,000 families about a variety of medications, treatments, and diets for autism. They reported that the two most beneficial treatments, according to families, were diflucan and nystatin, two antifungals. Very rarely did the families report these worsened symptoms. About 30 to 40% of the time, they said it did not help, but 50 to 60% of the time, they reported it was beneficial. And this is 1,200 families reporting the use of diflucan, 1,900 reporting the use of nystatin. We usually suggest using nystatin first because it's not systemic. It stays in the gut, so it's a bit safer. But diflucan is systemic. It goes throughout the whole body. So it puts a little bit more stress on the liver and kidneys. So you'd want to have your doctor probably do a basic kidney and liver test before taking it. Antibiotics, on the other hand, you'll see tended to worsen symptoms. You're much more likely to worsen symptoms than to improve symptoms, according to 2,500 families. So we recommend avoiding those if possible. But often these yeast infections, when you treat them, will return. And I'll tell you about a case study where that occurred. So it's important to also couple it with a low sugar, what we'll call a candida, anti-candida diet, where you're trying to avoid sugars. And that also seems to be very beneficial. We don't need a lot of artificial sugars in our diets. And now let me give you a case study of one family who did the test with Analutos, 16-year-old boy with both autism and ADHD. Analutos test revealed he had high levels of yeast, so the family put him on 30 days of nystatin. And here are some comments from the family. We noticed a remarkable improvement in cognitive clarity. Hand flapping decreased significantly. Sound sensitivity improved dramatically. He became calmer, happier, and more engaged with those around him. His attention span improved. He appeared more present and connected. Our family felt like we were seeing more of the real Sam, not his name, but again, within just 30 days, if you discover that you do have a yeast infection, it can be treated and you can see benefits that quickly. But then they stopped nystatin and they found that they lost many benefits, that the treatment seems to be needed to be used longer term, again with an anti-candida diet. So they then restarted with another antifungal, diflucan, and the benefits continued and grew over time. So they treated with diflucan and found cognitive improvements was profound and continues today, a year later. Anger and emotional outbursts are essentially gone. Attention span and focus have improved significantly. He lost his ADHD diagnosis. Sound aversions are now next to none. Hand flapping and repetitive behaviors have greatly decreased, so probably much less anxiety. He's more socially engaged and willing to participate in conversations. He's more flexible, open to trying new things. His interests have expanded. He now enjoys age-appropriate action movies. He advocates for himself regarding his gluten and dairy allergies. So after 1 year, he's been on diflucan now for 1 year. And now, based on the treatment, he completed his freshman year of high school with a high GPA. First time he's been doing well in school. Transitioned to a school for higher level learners with autism. Completed a year of chess club. He started swim training to develop competitive swimming skills. He's made these gains without any private speech therapy out of just the basics he gets at school. Family says we're now able to travel together as a family. We're comfortable going out in public and participating in activities that were once very difficult. He's developed new interests, hobbies, and confidence, and his family's overall quality of life has improved tremendously. So again, this is one example of where antifungal therapy can be very helpful. Can't say it always helps every family, but often it can be very helpful like this. And then briefly, I'll just touch on microbiota transplant therapy. That's really an approach to replace the whole gut microbiome. It is an investigational treatment. It is an investigational treatment to treat severe gut issues. We've completed 4 successful clinical trials for autism and Pitt-Hopkins. We have 2 more clinical trials underway. We've seen up to 80% reduction in gut symptoms. On average, we've seen in some studies severe autism decreasing to mild to moderate autism, with benefits usually continuing at 2 or more years, because unlike with standard probiotics, these microbiota are from the gut and they engraft in the gut and stay there. So we formed a company, Gut-Brain Axis Therapeutics, to fund the clinical trials to achieve FDA approval. We're getting close. We're now starting to plan our final phase 3 study. This is a very unusual company. We're funded by autism families. Over 120 autism families have chosen to purchase stock in the company, and that's what's funding us. But we now have openings for more families. So I'm going to skip over details in MTT because I've presented that in other studies. If you have questions, you can ask me during the Q&A. But I will just say that, again, GBAT is a unique company funded by autism families to help autism families. We are having a meeting, our next meeting for potential investors, June 18th. So in a week, if you'd like to join us at 7:30 Eastern Time, we'll have a small discussion group there with people who are interested in investing in GBAT, and we welcome that. Really, we think it's for autism families. We need to help ourselves. So just to summarize, what we've tried to cover today is to let you know that our data shows that roughly 90% of children with autism have a gut infection. And that gut infection can be tested for by measuring microbially derived metabolites in urine. It's very simple to do. There are over 40 studies which support us. Over 40 other studies have found many of these elevated metabolites. We've discovered several others. We know that some of these metabolites are known to be able to directly interfere with dopamine or serotonin or melatonin. Some of them are known to cause autistic symptoms in animals. And in one study, they found they could recover those animals back to normal. It's just a microbiota transplant from a healthy animal. And that's what we're doing with children with autism. It's just giving them gut bacteria from healthy people. Our testing is now available both worldwide from Analutos. Anyone in the world can send samples to them. And also our new US lab, Autism Diagnostics, which is a CLIA-approved lab, which we hope to be able to get insurance coverage for families. And we're now offering essentially the same test from both labs. And families can order it directly in most cases, but in a few states, you do need a physician to order it. And then the treatment, as we've covered a number of treatments that can be used today, but it can be complex. And again, it depends on the particular individual, but improving diet, we think, is a very key first step for many of these cases. But if you want more information on the microbiota transplant, you can go to Gut-Brain Axis Therapeutics. If you want more information on the 2 tests, you can go to Analutos or to Autism Diagnostics Lab. And then I'll just mention we want to thank the many, many families who've been in our studies. the many different groups that have funded our work. We want to thank the 80, now it's over 120 autism families who are funding gut-brain axis therapeutics. I want to thank our research team at ASU, co-led by my collaborator, Rosie Krajmalnik-Brown, and a research scientist, Kem Nirmalkar, and many others. And also we want to thank the University of Minnesota team, which makes our probiotic microbiota products for our studies. And special thanks to the Analutos team, Paul Whiteley and Kevin Carr, for working with us for several years. Very challenging to get tests to commercial production, and plus their hearts for working hard to make this test available. Now over 1,000 families have ordered it, and we hope it's very helpful to them. So now we're going to open it up for Q&A. And so if you have any questions, feel free to go through these, and Christina and I will do our best to answer them. So first question is, how long is MTT effective for? So in one case, in most of our studies, we followed children up to 18 months to 2 years. In most cases, the GI benefits continue, sometimes modest loss, but the autism symptoms generally seem to continue and to grow with time. So we see even more improvement in most cases as time goes on. We had one family who touched base with me 8 years after treatment, saying their son is still doing great. And so we don't formally follow families, but we have seen up to 8 years, families are still doing well. Some children may need a booster treatment. We know antibiotics can worsen symptoms, can cause a loss of benefit. 5 families have used antibiotics after MTT. 2 of those have lost benefit and needed to be retreated. Next question is, are there certain bacterial strains that are red flags for these results? Yeah, so for P. cresol, we know that it's primarily made by 4 species. Most of these are Clostridial species. So it's not exclusively those species, but it's very likely that those are problems. So vancomycin is very effective against many of those Clostridial species. Next study, my son has P. cresol. We started Epidiolex for medically resistant seizures. Seems to be helping him a little. Is there any connection? Okay, so if tyrosine, phenylalanine, and tryptophan are all low, those are all the key building blocks for those neurotransmitters, dopamine, serotonin, and their related neurotransmitters. So if they're low, it could be due to one of 2 reasons. It could be that they're not getting enough protein in their diet, or they're not able to break the protein down into individual amino acids. So your body's digestive system is designed to take large protein molecules, break it down into the individual amino acids like tyrosine, and then reassemble those. But some children's digestive enzymes are lacking. But in other cases, it's a bacterial infection where we found that if we see high P. cresol, then we're going to usually see low tyrosine. So that's a clue. It turns out that Christina discovered that many of the anti-seizure medications actually are antibiotics as well, which is very interesting and suggests that that's the reason those are beneficial. We have seen, there's one study showing that P. cresol is higher in general people with seizures, people with epilepsy, than in people with autism. So we strongly suspect that these are contributing to seizures, but we haven't yet done a study of people with seizures. That's on our to-do list. The test was with Analutos in December 2024. Okay. Yeah, that was a high level of P. cresol at that time. Next question, how does one decide which test to select? If you're outside the US, you should certainly use the Analutos test. If you're in the US, you have a choice. Both are good tests. We recommend either. Again, families can order either one. And so we think both are useful. Next question is, which autism severity levels are typically detected? All. So we did not distinguish between children with mild, moderate, or severe autism. Our study included children across the spectrum, so all of those tested positive. It was just the 10% or so who seem to have an underlying single gene disorder. So if you don't test positive, then it's very possible that that someone missed um, doing a genetic test, and we would suggest a full genetic workup now if that's the case. Now, full genetic workups are much less expensive than they were historically. Um, there are some single gene disorders that can be detected at birth through heel prick testing, but many of these are missed. They're just so rare. Next question, did you have any letter that could make a conventional primary care provider less hesitant in ordering the test and indicate succinctly what can be done with the results? Yeah, so the paper we published, um, would be a great first step to give to a physician to tell them this is published in a major journal, a Nature journal, molecular psychiatry. Table 1 shows there are 40 other papers supporting this. These are all very legitimate metabolites to measure, and we recommend doing that. Treatment, however, is complex, and a regular physician may not know very much about how to treat it. However, there are what are called MAPS physicians in most states. So MAPS is an organization called the Medical Academy for Pediatric Special Needs. I've spoken there many times. MAPS has 3-day training programs for physicians about integrative testing and treatments that can be done. But also on our website, we talk more about these treatments, and we'll have a basic handout on what we can do for these treatments. I've covered some of these points. As a testing lab, we're limited as to what we can say, but I forgot to mention one very important thing, is that our nonprofit, the Autism Nutrition Research Center, also has a consultant who I've trained, which is able to talk with families and help them interpret their results if they have trouble interpreting them. So they're very low cost because they're with our nonprofit. I think it's $40 for a half-hour consult with them. Usually half an hour is enough, and they can help you interpret the test and suggest different options for treatment. But some treatments, like certain prescription antifungals, you would need a physician to prescribe. But you can go to the MAPS website. There are MAPS physicians in most states, but also there may well be other physicians who would be open to this. It's a new test. It will take time for people to get used to it. How is this test different from an OAT test? The OAT test is a more general test. It does test for a few microbial metabolites, but this test is much more extensive at testing for many more. Our test is published. The OAT test has never been published, even though it's been used for many years. There's not been a formal publication of it. So we have done the formal work to do a formal research study to establish valid pediatric reference ranges. So our test, we think, is just much more comprehensive for looking at microbial metabolites. Next question is, how does this test take into account SIBO? So SIBO stands for small intestinal bowel overgrowth. So if there's a bacterial infection in the small intestine or in the large intestine that is producing these toxic metabolites, then it would be able to detect those. So I can't speak to every type of SIBO infection, but we think it's likely that some would be detected. This is a new test, and we'll find out for sure as time goes on. Does this test tell us if mold toxicity creates gut problems? So there are some metabolites that we currently test for that are made by fungi, but mold is related but separate. Our current test does not include mold toxins, but give us 6 months and we'll probably be adding that to our test panel. Can you make the presentation available? This presentation is being recorded, and thank you very much for coming to the talk. Everyone who's registered for the talk will receive a copy of the presentation, so you'll be able to look at it at your leisure. Do you find any correlation between oral microbiome and gut microbiome? In our study, we focused on the gut microbiome. You might think that they're connected, but they're actually very different. The oral microbiome obviously is exposed to oxygen. In your gut, you have very different microbiome because you have very, very small amounts of oxygen present in your gut. So most of your gut bacteria are what we call anaerobic bacteria. So they're very different. There is some correlation that we do see that some bacteria from the oral cavity, from your mouth, can obviously get down into your GI tract and colonize it. But again, they're generally very different gut bacteria. But we've not done formal evaluations of the oral gut microbiome. If you think about it, the amount of bacteria in your oral microbiome is tiny compared to your gut microbiome. When you have a bowel movement, about a third of that is gut bacteria. So we're dealing with orders of magnitude more bacteria in your gut than in your mouth. I don't want to discount oral microbiome infections. They can be important for heart disease and other factors, and they could be useful for testing. But we're focusing on the gut microbiome because most of your serotonin, 90% of your serotonin and half of your dopamine is made in your gut. And you need it there for your gut because your gut is like your second brain. It's very complex, and you need those neurotransmitters in your gut to properly digest your food, to send signals to your brain that you're full or you're hungry, that you're happy or you're unhappy, etc. How is this test different from the oat test? I think I've just answered that. Um, if the test shows gut imbalance, who can help guide the treatment? So again, we have our consultants with ANRC who can help guide treatment for you if you don't have a local physician, but they can also work with your local physician. They can help explain the results to them or to you, and then your physician can prescribe treatments. But in many cases, the treatments are things you can do yourself. As I mentioned, instilling a healthy diet, a fiber-rich diet. There's a recent study suggesting that yeast infections are can be partly treated just by increasing fiber content. This is a study in mice, but it's very possible that will be important in children with autism as well. Are the metabolites that can reveal mycotoxins colonized in the gut? Um, Again, mycotoxins probably are not going to colonize in the gut. They're probably going to colonize in so you have very different bacteria and yeast and fungi in your gut typically than what you'd have in your environment. But it's conceivable that they could. How do you collect microbiota from healthy humans? So we collect stool samples from very healthy, very carefully screened humans. We then purify the stool very gently, but very carefully and thoroughly. So it's 99% live gut bacteria. It's so extremely well purified through a patent process that my colleagues at the University of Minnesota have patented that we end up with basically a probiotic powder that is so pure that families now mix it with a little bit of milk or yogurt and swallow it without any problems. Even kids with autism who are very sensitive. It's again odor-free, taste-free. That's where you want to get your good, healthy gut bacteria from. Any studies or have you looked at treatment protocols with flagyl vanco, nystatin diflucan to treat C. diff or high p-cresol levels? So vanco is a standard antibiotic for treating C. diff when it occurs, but also just in general, overuse of antibiotics can cause the overgrowth of C. diff. Um, so nystatin is diflucan are used to treat yeast infections. Vanco is used primarily to treat C. difficile infections. When you have a C. diff infection, usually you would then have high p-cresol levels. But there are many other types of bacteria as well that can cause elevated p-cresol. Do you recommend doing the test after completing a treatment protocol? We recommend doing a test beforehand to help you guide your treatment, which type of treatment you should use. I recommend doing it after you complete the treatment several months later to see if you lowered it, but if you lowered it only part way. With our microbiota transplant studies, we've seen that we've decreased the number of microbial metabolites by about half. We haven't eliminated them, so I think we've been underdosing. So now we're going to higher doses in our studies because I don't want to just decrease autism symptoms from severe down to moderate. I want to decrease them all the way below the cutoff for autism. So I think these are very major clues with this test. So I encourage using the test after treatment to see if it's been beneficial and to continue using it to see until the levels are in the normal range. What's the MDM test? So MDM stands for microbially derived metabolites. That's the test that's available from Analutos and from Autism Diagnostics Lab that we've been talking about tonight. What doctors in the area do you feel confident will treat the child based on these labs? Some pediatricians might be knowledgeable, but most are not very knowledgeable. When they think about yeast infections, they generally might think of a vaginal yeast infection. That's pretty common and pretty standard for treatment, but they're not so used to treating gut infections, gut fungal infections, because when you have yeast in your gut, we found it does not correlate with GI symptoms. It's a hidden infection, and the only symptom is worse autism symptoms. Again, if you think of the analogy Christina mentioned about the effect of alcohol on your emotion regulation, you might be very giddy or you might become very angry. It's very hard to control your emotions. Your speech might slur, your coordination might slur. So your judgment, your cognition will become impaired. These are basically, you can be drunk in alcohol, you can be drunk on these types of metabolites, to put it in lay terms. But so the symptom for yeast infections just seems to be worse autism symptoms. And so that's why we think it's so important to do a test to let you know if they're there or not. And if they are there, then to help guide your treatment and find out, is it a mild infection? Is it a severe infection? Um, Thank you. Where are the microbiota products from? I think I've already described that. University of Minnesota has very strict criteria. They use donors from the top few percent healthiest Americans. They cannot, they're regulated by the FDA, so they can only provide products for research studies like ours until we can raise the money to get it approved by the FDA. We're trying very hard to get it approved by the FDA, but it costs a lot of money and takes a lot of time to get there. And we're getting close. We just need to raise money for one more study. Is the MDM Plus test available in the US? Yes, the test is available in the US. We've made it available in the US from a CLIA approved lab, so that way you can get insurance coverage from it. If you don't see it on the site, again, the site to go to is the site I list here, autismdiagnosticslab.com. Oh, the MDM Plus may not, we just upgraded the ordering. So it could be the MDM Plus isn't available yet. It might be available in the next few days. Let's see, is microbiota transplant therapy the same as microbiota fecal therapy? Yes, similar. My colleague at University of Minnesota actually developed the term fecal transplant, fecal microbiota transplant therapy. But that was used for C. diff infections, which are very easy to treat. One dose of human stool administered through a colonoscopy or a rectal enema or through a nasal gastric tube into the stomach, just 1 to 2 doses. You go from dying, because C. diff is life-threatening. Many thousands of people die from C. diff infections. The diarrhea is so severe. You go from dying to being symptom-free in 2 to 3 days and also cured for the rest of your life, that you are almost never, ever catch C. diff again once you've been treated. So with fecal transplant for C. diff, it's just 1 dose. For autism, it's much harder to treat. So we pre-treat with vancomycin. We found that's very important. And then we do a bowel cleanse. And then we do daily treatment for many weeks. And that's what seems to be needed to actually get rid of these very persistent gut infections. Again, we've studied adults with autism, 20, 30, 40, 55 years old. These GI symptoms almost always begin in infancy. They're very, very tenacious. If they developed in infancy, the human immune system just seems to think they're part of normal, and unfortunately. And so they need a lot of help to get rid of them. All right, I'm going to pause for a moment because Christina's been very quiet, and I want to make sure if She wants to say any words on anything I've covered so far, Christina, before we go on with questions. I'll let you think about that. All right. Is our company providing medical support for families who get this testing? Yes, but as a testing lab, we cannot give advice directly to families. What we can do is talk with your physician directly. So we would be pleased to talk with your physician. Tell them they can call us, and we will be pleased to have our experts explain to them the testing procedure, explain to them the type of treatments that we recommend they consider. And I think they'd be very comfortable with most of these treatments that we've discussed, a healthy diet, fiber supplements, etc. But yeast infections is going to be new for them for treating an intestinal yeast infection, whereas vaginal yeast infections are very typical and common to treat. Um, and so again, our staff is very willing to help you both with insurance coverage. We can't guarantee, but we're happy to help you have your physician request authorization from your insurance company. Your physician has to make the request to the insurance company, but we're happy to provide a copy of the paper, happy to provide a copy of slides, and any other information we need. We want to help make this test as free for you as possible. And who will be providing medical management of the test results? Again, your physician has to be the one providing care, not a testing lab, but our ANRC consultant can also give suggestions to you. My son has CFC syndrome. I'm not quite sure what CFC is, so maybe email me later. If anyone has personal questions I haven't been able to answer, feel free to email me, uh, jim.adams@asu.edu. Um, but the test is probably going to be helpful to many other people with gut and gut-brain symptoms. We know, for example, in Parkinson's disease, people with Parkinson's have 8 times the normal amount of paracresol in their brain. And that's probably why adults with autism are at high risk of getting Parkinson's and getting it earlier in life. So we want to help you not just prevent autism, we want to decrease your risk of Parkinson's. Kids with autism are also at higher risk of chronic kidney disease because some of these toxins, like P-cresol, damage the kidneys. And so again, we want to help your child avoid and prevent these longer term problems. Another question about seizure meds. Your son is currently taking Lamictal and fucosamide. Did you say seizure meds could worsen the gut? It is true that some psychiatric medications can worsen GI symptoms. So you should, when your physician prescribes them, hopefully they would let you know that. On the other hand, many anti-seizure medicines, Christina has discovered, quite a few of them are actually antibiotics, that probably one of the ways they work is by killing off bacteria that are causing seizures. Again, this is hypothesis. We can't say for sure, but it's very striking that a number of effective anti-seizure medications are actually antibiotics that will act in the gut and alter your gut bacteria. And that might be part of the mechanism of action. Um, Again, so we're very intrigued by that and want to do more research on that. We did this test. It was high in yeast, did a comprehensive bowel test, but no yeast is present. Yeah, so the limitation of a culture test is that culture tests look for yeast and it can be very difficult to culture it properly. So in this published studies, and we did a study with doctors' data 15 years ago, we found about 25% of kids with autism had positive yeast versus a much lower fraction of typically developing children. But the cutoffs for culture tests, they're using 1 plus, 2 plus, 3 plus, they don't have a reference range. This is a rather qualitative test. And so if you see a positive result, you certainly want to treat it, but it's very possible for it to be missed. We found that even the lowest level of infection, in our study, most of the kids who tested positive on the yeast test had only a 1 plus, but we found in that study that the kids with even just a 1 plus yeast had significantly worse autism symptoms, but not worse gut symptoms. So the issue is that it doesn't take much yeast to cause problems. Whereas most of your stool, a third of your stool is gut bacteria. The yeast don't mostly form in the stool. They mostly coat the intestines. They form colonies there and only send spores and small individual cells into the stool itself. So the amount of yeast in the stool is very, very small because it's mostly existing as a biofilm on the intestine. So if you get a positive result, you certainly should treat it. But we think our test, because we're able to look quantitatively, um, and urine, think of it this way, urine is a very homogeneous media. Stool varies greatly from one part of the stool to another. And so it's very inhomogeneous. All right, moving on. More studies are required. Well, I'm a researcher. Always we want to have more studies, and we're working. Christina showed you preliminary results from our second replication study. We've replicated the MDM test in another group. Any cases where you can falsely abnormal levels, things to avoid or do prior to collecting the urine sample. To avoid, we don't require any testing of any pretreatment. The one thing we recommend avoiding is alcohol because alcohol, there are some substances in it. If you're drinking wine in particular, wine, beer, just avoid those for 24 hours ahead of time is what we would recommend, and not excessive amounts of sugars. If you digest high amounts of sugars, you might see a little bit higher levels of yeast metabolites, but it doesn't seem to be a major factor. The children in our studies were all taking their regular diet. Now, some of these kids are on very limited diets, but we did not require anything special of them. We do recommend that the urine be collected first urine of the morning, if possible, just because it's more concentrated, so we get a more clear result that way. But some kids we can't do a first morning urine. They're in diapers, they're peeing during the night. So just a first morning urine is fine, or a spot urine is fine. How do SSRIs affect the test results? SSRIs should not affect the test results at all. The way SSRIs work is um, they're selective serotonin reuptake inhibitors. What that means is that when your body releases serotonin from a nerve cell, then it is temporarily in the synapse between nerve cells. And the SSRI keeps it there a little bit longer. So it keeps it between in the synapse a little bit longer before it's then reabsorbed and reused again. But what we're testing is it's not going to be a factor. We're looking into production, not if it's momentarily there for a moment longer. I don't see how to order the MDM Plus test. I apologize. We just created the lab, just got the lab test ordering set up a week ago. The MDM Plus test should be available within a few days. Um, what specific foods are rich in fiber? Okay, so fiber-rich foods would be whole fruits, so eating a whole orange, but not drinking orange juice, because orange juice does not have fiber. So it has two problems. One is that you're then going to get a sugar rush more quickly, so it's not as good for you. And also, you're lacking that fiber. The fiber is so important for your gut health. The average women consume only half the recommended daily fiber. Men are worse. We consume only a third the recommended fiber. And fiber is the primary food, is converted into butyrate by certain gut bacteria. And butyrate is the primary food, provides 60 to 70% of the energy for the cells that line your gut. So unless you're getting a lot of fiber, and most people aren't, the cells that line your gut are literally starving for the key nutrient. So whole vegetables, whole fruit, um, beans and legumes, you have to be a little cautious with those because they're so rich in fiber. You want to increase fiber gradually. Your body needs time to adjust to higher fiber intake. And also whole grains. So brown rice, but not white rice. Whole grains, not white flour. Where can we order capsules from? So our microbiota capsules are not available except for research studies. The FDA won't let us give it to them until they're approved. So we need to do phase 3 studies. We need to do a major phase 3 study. We need to raise about $25 million to do that study. And so we hope families will recognize how important it is and help us raise those funds so we can do the final study we need to get this very promising treatment approved for children with autism. Thank you for your kind comments. Um, Thank you. But I think we've covered almost everything. Can a child with many food allergies benefit? Yes. So the fascinating thing is that we have seen one child in our study with severe nut allergies lose those nut allergies. At Harvard Medical School, they're using treatment from the product from University of Minnesota to try to treat life-threatening peanut allergies. That your immune system is largely focused in your gut because that's how you're exposed largely to things from outside your body, from the food you eat, the water you drink. And so by um, uh, helping the gut, by getting rid of these infections in the gut, seems to be able to downregulate the immune system. Also, some of these toxins, like p-cresol, literally damage your intestines, so you have leaky gut. So partly digested food. Think of that waste from your stool. Do you want that waste getting into the rest of your body? So again, waste products from your food get into the rest of the body and likely contribute to food allergies because your immune system says, hey, this waste product shouldn't be there. This partly digested food should not be there. So we think that, again, we've seen a few cases and there's more investigations that we think that that's going to be a very important issue. Moving on, do we have any recommendations from moms of autistic children who would like to have more children? Yes. So many recommendations. Send me an email. But I've spent 5 years because I have a typically developing daughter who had a grandchild. So I spent 5 years researching how to develop an optimal uh, prenatal supplement for children with autism, for children in general. Uh, and also much of it relates to autism. I was just in an all-day workshop yesterday. I'm the co-founder of the Neurological Health Foundation, which is dedicated to helping women have healthier pregnancies and healthier babies. So email me and I'm glad to send you more information on all of our prenatal work. But in general, a healthy diet, a comprehensive prenatal supplement that includes all vitamins and minerals at meaningful levels. We have an app on the iPhone which rates over 180 prenatal. Some are much better than others. Making sure you eat fish that is high in omega-3s, but not high in toxins. There's a lot more. It's a rich issue to discuss. All right. Thank you all very much for all your thoughtful questions. Christina, do you have any final comments you'd like to share before we close? Again, I want to tell you guys, Christina's been a brilliant student and now colleague for me to work with. So we owe a lot of thanks to her for working with me on developing this test. All right. Thank you all. Again, feel free to email us if you have any individual questions. Take care. Bye-bye.